Esa.
Okay, good. So what I plan to do is just to show two techniques. First with the nerve stimulator, doing some nerve mapping, and then I'm also going to do the ultrasound guided block of the median nerve, because the incision is on the palmar aspect of the thumb, which is supplied by the median nerve. Most people feel that it's the radial nerve supplies the thumb, but it's actually the median nerve that supplies the anterior aspect. So to start off with, just to show you that you can improvise in the OR, or the operating theater, I'm going to map the nerve at the elbow using, hopefully, the traditional technique. And you can see there that what I'm doing is I've identified the median nerve, and I'm showing that you can stimulate it transcutaneously. Now that requires a special probe, but sometimes a special probe is not appropriate for kiddies because the tip is quite large. So what you can do is improvise and use your Stimuplex needle. So what I'm doing now is just changing to the needle, Stimuplex insulated needle, and you can make the nerve twitch without going through the skin. I'm just trying to organize myself for the camera, and all I'm doing is touching the skin over the nerve and producing the twitch of the median nerve. Okay. So that's, if you don't have an ultrasound, you can still do this. You need to know a little bit of anatomy, but ultimately you can find the nerve by stimulating it transcutaneously. Okay, so that, I'm not going to use that technique on this occasion. I'm going to use the ultrasound because that's what people want me to do. And so I've put some jelly over the median nerve, and the median nerve is the easiest nerve to find because it's in the middle of the arm, and it's now in the middle of my picture. All right, and the arrow is pointing out the nerve. Now, for the sake of sterility, one can use a tegaderm, which is quite expensive if you're from the developing world or you're in a rural hospital that doesn't have a big budget. And you can simply, obviously in a sterile manner, you can place it over the probe and it acts as a probe cover. So I'm not going to do that now, just simply because of the movie, and I want you to be able to see everything that I'm doing. So what I'm going to do now is place the probe. All right. First of all, you need to, as I said yesterday, you need to identify which end of the probe you're going to be coming from. So I do that by putting my finger over the probe, and you can see it on the ultrasound screen. So now I move it because I know it's coming from this aspect. I'm going to move the nerve closer to this side of the probe, and I'm now going to clean where I intend putting my needle. And this is alcohol chlorhexidine preparation that I'm going to be using. I've drawn up some local anesthetic in a syringe, and on this occasion, if I can find the syringe, I'm going to use a standard needle, it's a 23 gauge needle. And with ultrasound, you don't need to use short bevel needles anymore because you can actually see yourself going through the tissue planes. You don't need to feel the pop as you go through. Now you're also not going to do any damage to the nerve because you can advance. And I'm just getting through the skin in case this kitty moves. He has moved a little bit. And so now there's my needle approaching in the top right hand corner, And I want to now change the trajectory so that I aim for the nerve. Okay, there's the trajectory of the needle. I've got a little bit of a moving target here because he's under ketamine sedation. So forgive me as I adjust things. Oops. Let me just get through the skin here. Okay. The little guy's just moving a little bit because we gave him the ketamine some time back. Okay, so there's my needle advancing. I'm aiming straight for I'm seeing the tip of my needle all the way. I need to go just a little underneath. Going to pop through the fascia just there. Unfortunately, he moved. And now I can inject the local anesthetic. I can see the local as I inject. So I'm not in a vessel, a blood vessel. Obviously, you aspirate as well. You inject the local anesthetic, and you can see it now surrounding the nerve. I can advance my needle, because usually when you've got local anesthetic, let me just find my needle again. There. Okay, there's my needle. I can adjust and go for where I want it to go. Inject a little bit more local, and you can see it now surrounding. If I want to complete it, I can actually go underneath the nerve now and inject some more local just there. And I've now surrounded the nerve with local anesthetic. So I'm adjusting all the time. That is 2 cc's, which is more than enough, but I'm just showing you for the sake of the movie. So you can see that I can see where my needle tip is. I'm moving it gently. The nerve is surrounded by local anesthetic. I'm going to give it a little bit more just to show you. There's a little bit more. And now I'm going to withdraw the needle. And you can see the needle. I've got good view of the needle all the way out to the skin.
Check.
And the block is now done. Thank you. What we didn't do, but we have done prior to this, was we checked to make sure that we were doing it in the left finger. I also checked to see that this was in fact the pathology, because you certainly don't want to block the wrong arm. One, it's very embarrassing, and two, it adds risk, unnecessary risk to the patient. So that's the ultrasound guided median nerve block. You can block it closer to the wrist. However, it is a little, when it runs into the carpal tunnel, you can cause compression. So just simply for the sake of the movie, or the video, and the transmission, I went a little bit further up the arm so that you could visualize it better. I'm happy to answer any questions.
Any questions?
And I'm just hoping the block's going to work now, because my reputation's on the line.
Few questions are welcome. Any more questions? Anyone? Please.
Did that come through okay?
Any more?
Hello, is there any?
Yes.
Hello.
Hello?
Sir, one question, sir.
Do you have any questions?
Yes, sir.
Sure. Go ahead.
This session from this floor would be moderated by Dr. Guru Prasad, Dr. Johan and John, and Dr. Sajish.
Arun konja ella
So all the questions could be directed to them, and then we could ask them the questions. So, Dr. Adrian, they would like to see the nerve distally at the wrist level.
Okay, I will track the nerve all the way from the arm. Okay, so there's the nerve. You can still see the local anesthetic around the nerve. I'm going to put it in the middle of the, just hang on. I'll put it in the middle of the screen. That's where I've just injected. I'm going to go proximally so I can follow the nerve, and this is the one thing that you need to do with ultrasound. If you're not sure what the structure is, only nerves can be followed up and down the limb. You can follow the nerve from the spinal cord and trace it all the way to the periphery. So I'm moving up there. You can see it now in the middle of the screen. It's still in the middle of the screen. So I'm going upwards. I know you asked me to go laterally, to go distally, but you can see it right next to the median artery there. So now I'm going to go distally, back to where I was, where I injected. The local anesthetic is still visible around the nerve. I'm going to put it in the center of the screen. And now I'm going to follow it down distally. So what happens is you can see it in the middle there. Can you point it out with the arrow? Have we got the arrow? That's it there. So I'm going down. I'm following it down. I'm running out of gel. I'm going to put a little bit more gel on here. Okay, there's the nerve. I'm going distally. Oops. Trying to keep the nerve where the arrow is. Now you can see simply by rotating and tilting the nerve it changes color. And the other thing is it's now a little bit darker. Okay, it's very much a little bit upwards, that's it. And now I'm right at the wrist. And you can see you can block the nerve there. It's a little bit more difficult to visualize, but if you follow it down, you can find the nerve. Follow it back up again. There it goes. And we're back to where we started. There's the nerve. And now you'll see the local anesthetic coming around the nerve. Okay?
Okay, thank you, sir. We are two more cases. Two pediatric cases are there. Before that,